I am Brandon Muncy. I'm currently a senior major in kinesiology with a minor in nutrition. This presentation is over Dehydroepiandrosterone or DHEA. DHEA, as with many supplements, ranges in their prices. The range of the price is simply due to manufacturers, but this doesn't mean a higher price is considered better or safer. Look for USP verified labels and or NSF certified for sport, or check sites such as consumerlab.com or labdoor.com. The ranges I found per serving of DHEA range from 13 cents up to 62 cents. The supplement had a vast amount of claims that it could help. If the drug was able to do half of the things it claims it can do, it honestly would be a wonder drug. The first claim I found about DHEA is the use of anti-aging. I believe it's more chemical and physiological aspects of aging, which DHEA covers. Our body produces DHEA, which makes the drug actually non-essential in the first place. I bring this point up as a reason for the anti-aging function of DHEA is due to our body making minimal amounts of DHEA before puberty, rises high during puberty, and then falls as we age. An article named Mechanism of Action Anti-Aging DHES and Replacement of DHES mentioned that the mechanism of action, or MOA, is due to the mechanism of dissociation of cortisol DHEA synthesis, and aging depends on another regulatory of 1720 lyase or cytochrome P45C17, such as cytochrome P450 reductase. DHEA is also considered to be a supporter of mental health well-being, particularly in older adults, due to the aforementioned decrease of DHEA in aging. The mechanism of action, from what I found, is not fully known of DHEA in the brain. It is understood it is a neurosteroid as well as a precursor for Androsterone, or ADT. It is believed that DHEA produces antidepressant or libido-enhancing effects in patients with midlife depression. The effect of DHEA on levels of ADT is considered to be a contributor to the enhanced mood, but research is not validating its claims. An article titled DHEA Metabolism to the Neurosteroid Androsterone, a possible mechanism of DHEA's antidepressant action, concluded that their small sample size was notwithstanding. Data emphasized the potential behavioral relevance of ADT in humans, which may include contribution to the antidepressant effects of DHEA. A different article by Medical News Today tells DHEA may help protect neurons from toxins and after injuries such as strokes. It may also contribute to nerve growth, and it may help reduce inflammation and prevent cell death. The article, however, does disclaim that DHEA can trigger mania, psychosis, and other mood changes, especially in people with bipolar disorder and other mental health issues. The athletic aspect to DHEA is its contribution to its possible strength and weight loss contribution. A study on rats looked at DHEA and the ability it has at fat-reducing effect, while little information is available on whether DHEA regulates glucose metabolism, which would in turn affect fat deposition. The article was very detailed and looked at previous findings, which they found DHEA helped in the catabolism of glucose, but their final results showed little to no difference of rats fed a high-fat diet with a DHEA supplement to those fed with a high-fat diet without the supplement. An article looked at a 100 milligram dose of DHEA per day affecting strength and body composition had previously looked at a 50 milligram dose of DHEA for 3 months to age-advanced men and women, resulted in elevation of 10% of serum level insulin like growth factor IGF-I, accompanied by improvement of self-reported physical and psychological well-being. The finding resulted in an increase of serum IGF-I levels was observed in both genders, but dimorphic responses were evident in fat, body mass, and muscle strength in favor of men. Many other uses have been studied and attempted to be shown, but I picked out the uses which intrigued me most and which I found the best articles over. Many of the other claims that have been looked include bone density, which assumed to be due to the drop of DHE, which contributes to bone density. Not all studies showed positive impact. Anorexia nervosa, which may be due to the help of mood associated with DHE supplement, but the study I found supporting these claims had a sample size of 26 subjects with a p-value of 0.05, which is on the verge of not credible. Adrenal insufficiency is mentioned as one of the effects of the disease is low DHE levels that may contribute to health. As well, it may help other uptakes of nutrients in the body and the production of other key steroids. There are risks with AI patients that DHE may cause worse mood changes. Supplementation of DHE is not recommended as a long-term solution, so the use is insubstantial to truly be needed. Lupus in women is shown to lower DHE levels, and using supplementation can help increase to normal levels. It was shown in one study of lupus DHE helped symptoms in those which were mild to moderate. Sexual dysfunction in many other adults is shown to occur alongside the decrease of DHEA. This is assumed to be due to the DHE effect on many sex hormones. The results are best seen in women postmenopause, but for men, it included DHE administration is not useful for improving male sexual function. HIV prevention research has been looked at with the use of DHEA, but many studies have shown it has no effect on prevention of HIV and is not recommended for the prevention of use. Cervical cancer has research for the inhibition of proliferation of cervical cancer cells and could protect against the migration of cancer cells. I didn't see the contraindication found in the article, but other research I did supported against the use of DHE in patients with sex organ cancer, as I will talk about later. In this slide, I wanted to focus on a muscular strength and body composition article I found on ncbi.nlm.nih.gov. I briefly talked about this article in a previous slide with the effects of DHE on muscular strength. The objective of the study was to further research a previous article which was done pertaining to the intake of 50 milligrams of DHEA. For 3 months to age-advanced men and women resulted in the elevation of 10% of serum levels of insulin-like growth factor. The researchers wanted to learn the effects of a greater dosage, 100 milligrams, and a longer duration, 6 months. A small study group of 19 subjects, 9 men, 10 women, only 16 completed the year-long study. The year was split in half. The first 6 months, the subjects took a placebo, and the second 6 months, DHEA was taken. The measurements of fasting early morning blood samples were obtained. Serum DHEA, DS, sex steroids, IGF-I, IGF-PB1, IGF-BP3, growth hormone binding protein, GHBP, levels and lipid profiles, as well as body composition measured by a DEXA scan and muscle strength measured by MedX testing were measured at baseline after each treatment. The results showed DHE serum levels in both sexes, elevated IGF-I levels in both sexes, decline of GHBP in women, but no showing in men. For men, body fat decreased, knee muscle strength increased, and lumbar back strength increased. These findings were not shown in women. In women, total body mass increased, but no total increase in men. Neither gender had changes in basal metabolic rate, bone material density, urinary pyridinolin, cross-links, fasting insulin, glucose, cortisol levels, or lipid profiles. Conclusion came to mentioning these differences in response to DHE administration may reflect a gender-specific response to DHEA, and or the presence of co-founding factors in women such as estrogen replacement therapy. The question of is it safe should be considered with any ergogenic aid consumed, and DHEA is no different. The drug is made synthetically using chemicals found in soy and wild yam. However, consuming wild yam or soy will not enable the human body to make more DHEA. I put in this slide that ingredients may differ from company to company due to the production of supplements. Supplements are not regulated the same as medicine, as the FDA regulates them as food, and this means there are less strict regulations on production and distribution. They do not have to have back research for their claims, and this will always raise concern for ergogenic aids. Some facilities are less backed and regulated, as others are certified by companies such as USF or NSP. Contraindications partially mentioned in this presentation included people who have cancer or at risk of cancer should not consume DHEA. The main forms of cancer which are not recommended to take DHEA include sex organ cancers such as breast, cervix, prostate. I feel the reason for these contraindications are the use of DHEA in the production of estrogen and testosterone, which when upregulated would cause disruption of the cells in these areas. People taking anticoagulant or antiplatelet beta blockers, metformin, clozapine, anti-seizure or morphine, and opioid antagonist drugs should not be taking DHEA. To save time from listing off long side effects like a drug commercial, I would like to highlight the most severe or daunting side effects DHEA contributes to. Side effects appear to vary in a range of different groups and between diseases, and ranges between acute respiratory failure, eye problems, insomnia, low blood pressure, and bleeding and blood clotting problems. For women, they may experience smaller breasts, deeper voice, oily skin, or increased hair growth. For men, side effects include smaller testes, urgency to urinate, or enlarged or tender breasts. DHEA has been banned from many sport organizations such as NCAA, NFL, USA Olympic Committee. Many studies try to support the claim of the athletic benefits of DHEA, but many of the studies result in the opposite, result in no findings. The findings are murky at best, and side effects include maybe more of a reason for a ban than actual hope of benefits in DHEA's case. I feel that in this situation, these committees decided it is safest for the athletes to be banned from taking DHEA than banning based off performance-enhancing abilities. I wouldn't recommend an athlete to take his supplement based off the placement on the ban list, but I also believe the positives do not come close to outweighing the negatives in this drug. My works cited are in the description, and I also put the transcript of the video in the description as well. Thank you for watching the video.